Today we're diving into biostatistics. Sounds fancy, but it's really just stats doing important work in biology and healthcare.
Right? It's basically using numbers to make sense of health data, like figuring out if a new drug really works or just got lucky in a small trial.
Exactly. Clinical trials rely heavily on biostatistics. Without it, we wouldn't know if treatments are effective or harmful.
And it's not just drugs. It applies to public health too, tracking disease outbreaks, predicting risks, even optimizing hospital resources.
I always find it wild how a good statistical model can literally help save lives, like early detection algorithms for cancer.
Yeah. Or analyzing genetic data to identify disease-prone populations. That's some superhero-level use of math.
Though, let's be real, it's not always straightforward. You've got confounding variables, biases, missing data.
Totally. And that's where careful design and analysis come in. Biostatisticians don't just crunch numbers, they ask the right questions first.
Right, like deciding between a cohort or a case control study. That choice alone can make or break a study's relevance.
And don't forget statistical significance. People throw around p-values like candy, but interpreting them correctly? That's another story.
Haha, yep. A low p-value isn't the holy grail. It just means unlikely under the null, not this is absolutely true.
Exactly. Plus, effect size matters too. Something can be statistically significant, but clinically useless.
I think one of the coolest things is how biostatistics helps personalize medicine, like tailoring treatment to someone's genetic makeup.
Precision medicine wouldn't even be possible without statistical modeling. We'd just be guessing.
And now with machine learning entering the scene, biostatistics is getting a power boost. More tools, more insights.
Though with that comes the challenge of interpretability. A black box model might predict well, but explaining why it works? Not easy.
That's where the human touch stays crucial. Stats can guide decisions, but context and ethics have to follow.
Couldn't agree more, especially in health, where decisions affect real people, not just charts.
So whether it's fighting pandemics or improving patient care, biostatistics is kind of the quiet force behind it all.
And maybe that's the takeaway. It's the math behind medicine, and we probably owe it more credit than we realize.
All right, now we're curious. How often do you think about the stats behind your health?
Or better yet, would you trust an AI doctor with your diagnosis if it was built on biostatistics?